Yes.
All right, perfect. Floor is yours.
Is my screen visible?
Let me see. Anthony, did you give her ability to share?
Okay.
See it. Let's see. Yeah, there it is. Started screen sharing. It should come up now. Yep, I see it. Good to go.
Okay. So hello everyone, my name is Anne Ikone and this is my Vincent. I'm the Chief Resident at the Sunrise Health PM&R Residency. We're a fairly new residency program where we've just entered into our second year. Both Mike and I are a part of the first class. So we just put together a short presentation to allow for more time for questions at the end. So as you can see, even in this first picture that we have here, these are all of our current residents. At the moment, we have 11 residents, but our residency has capacity for 18. Here's another picture of us again. So our program is located in Las Vegas, and we're centered out of Mountain View Hospital, which is located in the northwest area of Las Vegas. We're part of the HCA hospital system, which is the largest GME in the U.S., and it has about almost 4,000 residents. The number is growing day by day, with about 170 hospitals in 20 states. Our current capacity, like I said before, is 18 residents. Our program director is Dr. Lee. He came from Mount Fiore and from New York, Brooklyn, New York, and he came to spearhead this new residency program in Las Vegas, and his contact information in our coordinator information.
Now, Las Vegas, super fun city to live in. You've got everything you know about Las Vegas with the Strip, with Cirque du Soleil, with all the lights, the Bellagio, the water fountain. But there's a lot of other things that people don't know about. You know, there are lots of music festivals. There's plenty of good boating with Lake Mead. We're not too far from Lake Powell. There's also a lot of great hiking. We've got Valley of Fire, and my personal favorite is Red Rock. Red Rock is maybe 15 minutes from the hospital, and it's some of the best hiking I've ever seen, and I'm from Idaho, so I definitely know hiking. But in addition to that, there's really good mountain biking, and then we're not too far. We're only 4 hours from the beach if you want to go west. We're only 2 hours from national parks that are amazing, like Zion's in southern Utah. So we're very close to a lot of different things, but the city itself has plenty to offer.
So yes, the three main sites that we do our rotations are Mountain View Hospital, which is a 400-bed acute care facility with a 36-bed rehab unit that's expanding to 42. Currently, because of COVID, the expansion has been put on hold in regards to opening up the extended beds. Then our other main site is Sunrise, which is was built off of the Strip to service the Strip. And so this is our large level 2 trauma center, and we have a 42-bed inpatient rehab unit. And this is a site where we also do our inpatient peds rotation. And then our third major site is the VA hospital. And that's where we do most of our outpatient rehab rotations. We do we have our orthotics and P&O clinic, ALS clinic, our Botox, and that's where we get a lot of our EMG experience. I just put this in there for anyone who's interested in compensation. Everyone gets money for their on-call meals, and we also pay for conferences. And each resident is given a cell phone. We don't have pagers, and the bill for the phone is covered. In addition, everyone gets a personal laptop or iPad, depending on the class. We do have a book stipend. Currently, we're using our book stipend to build up a library. So that's where our book stipend is going to at the moment, to build up our hard copy library. And each resident receives a stipend for a review course. And our membership fees to AAP and AAP&R are covered. Each resident has the opportunity to go on conferences as long as they are presenting. In total, we have 20 vacation days. 15 are to do whatever you want, and the other 5 we use for academic days. They can be for conferences, studying, etc. So the way our curriculum is structured is a pretty standard curriculum. Our PGY 2-year will spend most of the time inpatient, and those 9 months are split between Mountain View and Sunrise. And the remaining 3 months are at the VA or our Mountain View outpatient clinic. And then as we transition to our senior years, we do more outpatient. And we mostly are at Mountain View and the VA for those sites. We do have 3 months of EMG, dedicated EMG months, and we do have 1 month dedicated pediatric rehab. And then our 4th year is when we do have our 1 month of electives. Okay. We have didactics collect all together once a week on Wednesdays from about 1 to 4. The VA does have its own separate journal club. Now, during our MSK modules, we do join the Toro Medical School, and we go to their cadaver lab to supplement our education. We also have access to many ultrasounds, and our didactics are collaborative. We often join internal medicine, radiology, and our new neurology residencies. And we do have, we are allowed to bring different lecturers, mostly from the West Coast, but across the US to supplement our lectures. We do have this advanced simulations center. These are pictures of our current residents. And so in this sim center, we practice emergencies and inpatient rehab, we practice ultrasound, and we practice our injections. We do have our newly installed BTS Gate Lab. We've just now been able to set it up, and we plan on doing research based on, we plan on doing research and video recording of the subjects and helping guiding with the shots. And so yeah, we're hoping to complement our patient care with this new Gate Lab. And so thank you for your attention. I just included a bunch of pictures of our residents. If there are any questions, please write them in the text box.
Hopefully you can see them.
Yes.
So while we're waiting for questions, some things that I thought were a little bit unique to our program, having the cell phones is huge. When you're not on call, you can turn it off. That's kind of nice. Like nurses don't have your number, which is always kind of nice, but it's responsible, and it's nice that you have a separate personal and a business cell phone. That's kind of an interesting dichotomy that I haven't seen in a lot of other places.
Okay, so I believe this question here is for us from Saswaka. She's asking, she's a 4th year medical student, and she's asking what characteristics does our program look for? We look for residents who are very flexible, who are eager to learn, who are very who love working in groups, who are very social, who are compassionate, and who are dedicated to serving every kind of patient.
I want to add on that if I can. We're a new program, so we're still being molded a little bit. We're not looking to just fill spots with bodies. We're looking for people that are willing to bring what they can contribute to a new program, because our program is new. You know, this is, we're the first class, we have a second class, the third class is matched. But when you come to this program, you'll have a voice, because things aren't solidified like some of the programs that have been around since the beginning of time. We're still adapting, we're still molding, we're still changing, and we're listening to new residents, we're listening to medical students, to feedback. Even though the program's only been around for about 14 months, it's changed drastically just based on our class's feedback, and that will continue in the future.
And I see the question about virtual didactics. We haven't, in regards to medical students, we haven't done that as yet, but that's a great idea that I can take to our program director. Timothy, he's asking, what are some outdoor activities residents enjoy around the Vegas area? Obviously, the Strip, of course, but we're only a couple of miles from 5 national parks. I've been to 2. I've been to Zion and Bryce Canyon. A lot of our residents are, a lot of our residents are very active. We have some who are involved in MMA. We're in a perfect spot to travel because we're located in Las Vegas. It's easy to travel east or west with cheap flights. So if you like to travel, especially internationally, going east, it's very easy. Miss Ayana asked, what are your reasons for ranking Sunrise? I rank Sunrise because of my impressions of Dr. Lee as a program director. He seemed very genuine and compassionate. He seemed very relatable and personable and invested in my education. Any challenges? The only challenge that I feel like I've incurred is just being a new program. As a resident, you have to be leaders more so than maybe in a program that's more established. We're paving the way for the residents to come and having a impact. And we're trying to shape the culture of our residency program.
And I think we've adapted beautifully to even just the current COVID situation. At the VA, they're actually, I've been impressed, they've been able to, we do spend a lot of time at the VA, but they've been able to establish video visits with a lot of the veterans, which some of these veterans, they're an older population. And so for them to even get that technology and do as well as they have, I've been super impressed. How much of, and I wouldn't have thought PM&R was the type of thing you could do a virtual visit because we are so hands-on, but a lot of people have done super well with it, and the veterans are still getting that care they need without coming in and exposing themselves in an outpatient setting.
Cameron asks about sports coverage. What kind of MSK opportunities are there?
Yeah, so Dr. Sneed is our sports guy. He does a ton of MMA, so we have MMA opportunities left, right, and center. I've personally gone to a couple. I know people before were asking about soccer games. The Las Vegas Lights are here, and I've covered with the sideline for those games. We do occasionally with the Las Vegas Golden Knights. We occasionally, I'm not going to say we're with them every single game, but we do have opportunities there. And this is kind of across the fingers situation. The Raiders are coming to Las Vegas in the next year or so. Hopefully, I obviously can't promise that because it's still a little ways away. It'd be great if it happens. It may not. We were really hopeful for that. But so we have opportunities with hockey, soccer, and MMA are our big ones. A little bit with football with the high schools around. Not as much, but a little bit. So.
Miss Cynthia asked, how has being a new program affected your training? As a senior, we had to be very independent, and you have to be someone, for us, you had to be someone who could take the lead and someone who would take initiative, because you didn't necessarily have someone ahead of you showing you the ropes, giving you insight. And so I think it just made me for a better resident. And what is call schedule? I'm surprised I didn't mention this. We don't have one. I think that's why we don't have call. We don't do weekends. We don't do nights. We don't have call.
That was the bribe for getting us to come here. But I mean, one of the great things about being here is sure the schedule. That happens a lot of places. But even our didactics is protected time. That's time for our learning. And so our attendings are covering whatever it is, the floor, or the clinic is just simply not open at that time. So we're very protected as far as our time. We very much stress academics in this program, and that's why we don't have call, because we're expected to be doing research, we're expected to be doing QI projects, we're expected to be getting a grand rounds or whatever ready, a journal club, because residency is the time to learn, absolutely. And so they've kind of limited some of the, I guess, scut work, you might say, and in favor of the academics, because this is the time to have academics.
So Ms. Sandra asks, our research opportunities. So each resident is, I guess by ACGME rules, is required to do some kind of research project. I believe every resident, especially the seniors, has at least 2 or 3, whether it's a QI or, especially now with the GATE lab, we have research. And because we're a part of the HCA system, we have access to a national database with patient information. So, and there are endless possibilities. And Dr. Lee, he's very academic. And we do also, which is unique to our program, we have a dedicated research faculty member, staff. So she will help you design your project. She'll help you with your biostats. So it's very, and that way we're spoiled because
It's her whole job.
it's her whole job, and you can email her and talk to her, and she can help you with your research.
Because if you're like me, research is always kind of, it's that scary R word that you're like, I don't know about research, but she helps a lot. She makes it manageable. She makes it easier. She helps with the stats. Who remembers stats, you know, at this point? It just makes it more manageable. But we have, being part of HCA, it's one of the biggest national corporations of hospitals in America. And so we have access to a ton of data. So if you're more the type that just likes to do a data review, we've got that data, no problem. So don't worry about us being a new program. We're a part of HCA that's very established. Not a problem there. Our new gate lab is like $500,000 or something crazy. It was ridiculous, and it's super nice, super fancy. It allows us to do gait motion analysis. It allows us to detect even small fluctuations in the way people walk. And that's an area of interest of mine. And so I was stoked about that. That was one of the reasons I ranked the program so highly.
So the next question, what is the faculty to resident ratio? I would say the faculty to resident ratio is between 1 to 1 to 1 to 2. It's about one. I would say
those official numbers. Yeah.
Yeah, it's about. There's one faculty member for at least 2 residents.
That's true, especially at the VA.
Especially at the VA.
At the VA, they outnumber us. Like.
Yeah. So especially so our PGY 2-year, we were outnumbered at our own didactics.
Sure, absolutely.
So it's about 1 to 2. Are there any other? Oh, go ahead.
Oh yeah, just at the VA, they're super. I love the VA. I didn't get to go to the VA very much in medical school, so I was very uncertain about it, but we spend a lot of time at the VA, and I've come to love it. They're great at our VA to pull us out of maybe a bread and butter and not that interesting case, and the attending will take over. Another attending will pull us out because they're like, oh, we have a kind of rare case. You won't see this very often. I think it's worth your time learning. So I've seen some crazy stuff at the VA, even though I should have been in clinic A, you know, I get pulled into clinic B just because it's better for my learning, and the attending takes over. And that's what I love about it is as residents, we're here to learn. They're not necessarily dependent on us to do the work. We're here to learn.
I'm just going to give you guys a 2-minute warning, okay?
Okay, thank you.
What are some exciting research projects that your residents and faculty are involved in?
The gate lab.
The gate
honestly,
lab.
There's just not a lot of those in America. We have everything from really simple ones, like my QI project. We all do a QI project. Mine's really simple. It's just about sleep and inpatient rehab and different interventions, what works and what doesn't. But then we have people that are doing all the way from like, you know, agitation and TBIs and things and spasticity. So really pick something you're interested in and go for it, because even if we don't have that specific patient population here, HCA does somewhere.
And another one is early mobilization after ICU. We do the Falls Project.
Yeah.
My QI project is increasing. It's about increasing continuity after discharge from inpatient rehab.
Right, getting people to actually follow up.
Yeah. So.
But yeah. What else?
Are there any residents interested in fellowships, and how do they get exposure to the subspecialties?
So we're newer, so keep in mind we're attempting, can't guarantee yet, we're attempting to start a sports medicine fellowship, hopefully. That's still a little ways down the road, and hopefully a pain medicine fellowship. Again, those aren't done, so we can't 100% guarantee, but we're hoping for. And what else would you say?
How do we get exposure to the subspecialties? Most of our exposure occurs at the VA. That's where we do our interventional pain.
Crazy things happen at the VA.
Yes. And then we also we do plan on our senior year to do our outpatient electives. Okay. Let's see. As new programs, are there any fellowship data?
So I'm gonna maybe one more question.
Okay. Oh, what are the current specialties? The current fellowships are interventional pain, cancer rehab, general physiatry. So I think that's it.
Thanks, guys.
Thank you for your questions, and feel free to email me. My email is in the PowerPoint presentation.
Awesome. Thank you, guys. We'll be getting that presentation out to everyone as well. Making sure that your contact information is readily available for any, questions that people didn't think of, or, they think of down the road or weren't answered. But again, thank you for being on the call. Thanks for the presentation. That was really nice.